I think the basic fact remains that there's a body image issue here. So I think here's a very interesting picture I've got together for the crowd. Now, you have to be a very daring person like Harnaam Kaur here, who decides that she can flaunt her beard and make it look a chic thing in the world. But it's not the easiest of things. So the self-love issue, as they say, this is one of those tabloids which come out in Britain. And, you know, you can celebrate your PCOS by becoming, instead of a Kaur, a Singh, but this is like a Kaur Singh, as they say. But, Madam, I think the important thing to understand is, so I'm trying to gauge here, what happens to a woman where she grows hair at the wrong place and where she needs hair? She's not growing them. So, as he correctly said, you have quite a few, 35, almost, 80% of females did notice alopecia, typical androgenic alopecia. Again, does that add to the distress? So, can you elaborate a little bit on that?
Yeah, losing hair on the scalp is another mental anxiety for young women, and honestly, a young girl growing a beard or a mustache or losing hair on the scalp is not a good thought for her. Boyfriends are a problem. Nobody's wanting to date them. Plus, they are growing overweight with probably lack of exercise and wrong nutrition, possibly. I'm not blaming that itself. But the question is that this is a lot of mental anxiety. And unfortunately, all these years, till we had more information on PCOS, I'll go back a little into history. The picture you showed me is a picture actually many, many years ago, hundreds of years ago. There was a woman with a long beard and she was holding a child in her hand.
Yes.
And that was a picture which was there. And there were two doctors who were wondering what's happening, what's going wrong. And they did some research on women who had, had these similar problems. And when they saw their ovaries, they looked like large ovaries, big ones. And they called them pigeon eggs. They look like pigeon eggs. This is 300 years ago. As years have gone by, and even when we were medical students, there was not much about PCOS at that time in our textbooks. It was just one chapter, and it was called Polycystic Ovarian Disease. Today, we don't call it a disease because we don't know what the cause is. We call it Polycystic Ovarian Syndrome. Because a girl may present in different ways. Every PCOS girls may not have acne, may not have facial hair, may not lose her hair from the scalp. And this is something which happens, and you get different types of women with different issues. And therefore, it is syndrome. Now, when a girl has this problem, she goes usually to a dermatologist.
Yes.
When she goes to the dermatologist, if the dermatologist is not aware that this is one of the problems associated with PCOS, she's treating her acne, she's treating her facial hair, she goes through waxing, she goes through laser, she puts in injections into her scalp. She does all that, but the condition doesn't improve.
Yes.
Until the dermatologist tells her there's something wrong with your hormones, you need to go and see the gynecologist, or you need to see the endocrinologist and get yourself corrected.
So I think you're bringing out a very important point. The point of first contact of this adolescent girl who's distressed may not necessarily be the person who she eventually will have to meet, one. And two, the possibility is there can be misdiagnosis or, for that matter, misdirection in regard to her management. And I'm happy that you brought out this issue because a lot of our colleagues will be seeing a lot of these girls come into their practice, dermatologists like you mentioned, or even somebody has hoarseness of voice. So a lot of people end up seeing various specialists. And I think it would be very appropriate now to bring in our third panelist who's been specially invited to talk of obesity and PCOS. So before we address the elephant in the room, as we say, and the technical part of the polycystic ovary, I thought you could throw some light on this obesity, which I think the slide is trying to highlight briefly. Please.
Yeah. Thank you so much. And thank you, Dr. Duru, for making me a part of this conversation. I think the connotation with which PCOS, from the nutritionist perspective or from the nutrition lens, to be looked at in India has to be slightly different. Because obesity and PCOS in India can present lean, overweight, obese.
Yes.
But the bottom line of presentation is the body fat or the body composition. and more so the body composition specifically in relation to the visceral fat, and which gets directly linked to hyperinsulinemia, insulin resistance, and that's what we have to actually address in PCOS. Besides this, what gets really highlighted from a nutrition standpoint is the chronic low level of inflammation. Now, in today's nutrition science, we have robust data to say that there are components of food, specific nutrients, specific bioactives, which can actually work towards insulin sensitization. It can improve insulin sensitivity, it can work on decreasing hyperinsulinemia, it can work on the levels of inflammation, and the moment, and of course, automatically it will work on visceral adiposity.
In fact, that must sound like music to Dr. Shashank, because anything that you don't need to give as a drug is always welcome. And she's talking about the research in dietetics that seems to help. Console, can I have the reverb down, please? The reverb down. We're not doing a singing show here. Get the reverb down. I don't want the echo or the reverb to be in excess. Bring it down. Our voice should not be booming back from us. Yes. Ma'am, I'm sorry. Please go ahead.
Yeah. So I said, so in any case, what Dr. Duru said and what Shashank said, managing PCOS, we all have to agree, has to be a team approach. And hand-holding, I underline the word hand-holding, because it comes in at such a delicate age that, people can swing in any direction. And that's where holding them on to the right path as a team is very, very important. So they need to go to the right person to begin with. And, the team has to connect with the stakeholders who have a role to play in the management. And a constant, direction has to be given to the person.
So there's a very important message carried across for all the people who are listening in, who are tuned in, I was told. Number one is there a multidisciplinary approach that needs to be taken in. And like she was saying, it's important to bring the right people with the right stakes who are likely to help her overcome the problem. And medicine alone doesn't seem to be the solution there. You would have something decentralized, if I may, where your core medicine may be part of your treatment, but not the entire treatment. So I think the obesity part we are going to touch upon. But Dr. Shashank, I would be interested in you looking at the genetic factors and overlap, as was mentioned. And we are going to make it friendly for our listeners online. I'm given to believe a lot of people have checked in online. Is that true? So if there are, I'm sure we're going to make this very interesting for them. So can you just decipher this slide for us? And how does it seem to, come down to the average person's thinking?
So, this slide is very technical and medical.
Yes.
And it only shows that there's a lot of clutter in this space. And it leads to a lot of confusion. So different type of specialists see PCOS. Most women go to a dermatologist or a cosmetologist where there are skin hair manifestations, either excessive hair growth or acne or hair fall or sometimes excessive sweating. That is a skin angle to it, and that's linked to an oversensitive male hormone receptor. The male hormone is connoted as androgen. Yes. That's the first component. Second is a large proportion go to obstetricians and gynecologists like Madam Duru and many others like you, who basically see them because there are irregular cycles. The cycle timings are not correct. Sometimes they don't ovulate on time. And sometimes they'll end up without having kids for a long time with infertility. So that is the second part of it. And rarely they'll end up with people like us, where they land up with a little bit of borderline diabetes, cholesterol, or a hormonal issue,
Absolutely.
Occasionally we have to investigate them.
Of course.
So what this slide is telling is there are different facets of PCOS.
Correct.
And the variants are there. So it is like different clusters. And we need to decluster them. What is the unifying feature? When you do a sonography, usually we see cysts in the ovaries. That is how it was traditionally described.
Correct.
So that is one part, the sonographic part of it. And therefore many women land up with sonography for something else. And they land up with a PCOS
diagnosis of
phenotype.
PCOS. And it's
Many people do screening.
Yes.
And they land up with abnormal hormonal reports and they land up with us. And there are also simple conditions in hormone medicine like hypothyroidism, excess prolactin, which occasionally can be picked up
Very
for
similar.
major underlying diseases like say a Cushing's where there is excess cortisol.
Exactly.
Or people who are taking some steroids. They also can look like PCOS. So I think it's a multidisciplinary condition. And all this slide highlights is that heterogeneity means that there are, it's not a simple 2 plus 2 equal to 4. It's a little more complicated than that. But the simple thing is that it could land up with any of the specialists.
Yes.
The underlying feature is the same. And the underlying feature is that the ovaries are not getting adequate glucose, which is getting transported because there is a defect in the transport mechanism.
It's a fantastic way to put it in very simple terms and to say that multiple points of contact for a first timer.
Yeah.
So I think I'm specifically coming to this particular thing. So carrying forward on the same point, a lot of subspecialists may actually get to see a woman, but this slide sort of sums up what are the organs that can be involved. Again, need not be the point of contact for a patient. So again, something put together.
Correct. So these are metabolic organs.
Yes.
You know, there is the liver, there is the pancreas, there is the fat tissue, there is a skeletal muscle, and there is the ovary.
Correct.
And then there is the master controller of the hormonal apparatus, the pituitary gland. But fundamentally what's happening is that, as I told you, it's like diabetes of the ovaries. And our simple metabolic organ is the liver. It is like an ATM machine. Whenever we need glucose, liver gives us glucose 24/7. Then savings bank is like our skeletal muscle. You have to go on a particular day and withdraw the money. And fat is like our fixed deposit. And these are our 3 stores of energy. So whenever we need this energy, either through liver or through the muscle or through the fat, we need to use insulin as a
password
pulley or a password to extract that glucose for energy. And unfortunately, as I told you, there is like insulin resistance in the ovaries. So it's like diabetes of the ovaries. And there are defects at each of these levels. And therefore, we need to recognize that these hormonal disruptions are causing a lot of challenges. And therefore, if you ask me the simplest way to describe PCOD, it is nothing but a state of insulin resistance, which means insulin is not acting properly. And it's like a mini diabetes of the ovaries. And that's the simplest way to say it.
That's the best way to actually...
Or sometimes we call it even a fatty ovary.
Exactly.
Just like you have a fatty liver, fatty pancreas, we also call it as a fatty ovary. And that's also okay.
You would agree with me, Shashank?
There may be stigmatization. Madam is scorning at me because she likes to use the word polycystic.
Okay.
Because they like to look at the word cyst.
Oh, we like to be gynaecologist, and 2 of our words getting into the field of subspecialty makes us even happier. Polycystic ovary. Yes. So that makes it even better for us. So I think we gynecologists have ended up taking a monopoly on this disease only because otherwise we'd be left out of this tremendous pursuit of medicine. So I think we are just putting this together, like you said. Again, an interesting thing for the audience here about the iceberg. Madam, maybe you can contribute by saying that, does this sum up the thing, and then Shashank can come in with his comments on it.
Yeah. So women would come to us, now I'm talking about women where we have made a diagnosis of PCOS. And I'll just simplify it for the audience. How we confirm the diagnosis of PCOS. There are 3 factors we look at. One
the criteria, as you say.
3 criteria.
Yes.
One is that the ovaries look polycystic. The second is where the periods are irregular. And the third is where there is skin issues. So if we have any skin issues in terms of excessive facial hair, acne, which we discussed before, or we see ovaries looking large or with multiple eggs, or they are actually multiple eggs, but we call them cysts because on ultrasound they look like cysts, fluid-filled cavities. And the third is when women have facial hair or acne. So the skin, the ovaries, and the appearance of the ovaries. Question is that any 2 out of 3, if they are present, then we say the woman has polycystic ovarian syndrome. She need not have all the 3 criteria. These are called the Rotterdam criteria. And any 2 out of 3 is good enough. So in short, we get different types of women, as I mentioned earlier, coming with different factors. As a gynecologist, usually I will see a patient who's come to me either because when she's got irregular periods followed by heavy bleeding, then she'll come to the gynecologist, or she's got irregular periods having difficulty conceiving, then she comes to us for fertility issues. The third time they come to us is when they are pregnant, and when they are getting, the pregnancy is getting lost every time she gets pregnant, she ends up with a miscarriage. That's the third time the patient comes to us. The fourth time is when she's 40 to 50 years of age. She comes with again erratic periods, heavy periods, etc., which we used to call dysfunctional uterine bleeding, which is now we call as abnormal uterine bleeding.
Madam, did you notice something very interesting? Shashank, I draw your attention to it. All 3 of us on the panel seem to have been like the mythical F-35 aircraft that's landed in Trivandrum right now. We had what are called as our transparency sheath, because of which the slides were being seen through us. And they conveniently moved you across to the hangars, as they say. So they are ensuring that now the slides are visible. So it just so happens that all of you are not transparent anymore. All of you are visible to all the cameras as well. And the point that Madam was making about there being no need for a clinical blood test other than an ultrasound, a clinical history itself can give her the umbrella cover to bring her under the polycystic ovary, was a development which took place interestingly and definitively, so that you had under the umbrella a huge number of women who would have different forms of polycystic ovary. So you would agree with me, it has become more definitive after the Rotterdam criteria, and people have something definitive to go on. And I'm sure the endocrinologists differ from us with the definitions and other things. But generally, Rotterdam criteria, the most cited paper on this issue, seems to be the point from which
these criteria have been sort of universally accepted now in 2023. There were many organizations who got together, which included the endocrinologists, the gynecologists, the public health initiative people, the researchers, everyone got together, and there were 1,000 people involved in this whole development of guidelines, which went on for 2 years, and a brilliant manuscript has come across. And today, if we do not have access to an ultrasound, or if a young person who is not yet sexually active and we cannot do a vaginal ultrasound because an abdominal ultrasound doesn't give us the correct information, another test called the anti-Mullerian hormone, AMH, if it is higher than what it should be, then that can be considered as a surrogate, as a replacement for the polycystic ovarian morphology which we see on ultrasound. So today, even the radiologists, when they write, they say ovaries are large, multicystic.
Kindly correlate.
This is for PCOD. So we have to call them back and say, please don't use this word. Say polycystic ovarian morphology.
Absolutely.
That is what we say, and that's the terminology we use now for polycystic looking ovaries on ultrasound.
Madam, once upon a time, PCO meant public call office. I mean, I don't know whether these guys know about such a thing. It existed. But today it has taken a different connotation. So I think PCOM is a more benign way of putting it. And in fact, Dr. Shashank, now that we have got into the thick of the discussion, this is a very nice way, the American way of saying fallouts. So whenever you have a war, you have fallouts. These are the fallouts, and I would like you to look at them before I hit the dietitian hard with all the data I need her to put on. So could you elaborate a little bit on this? And really, if I ignore PCOS in a woman, Do we have to worry
I
about
think
these
also
things?
just a point which Duru ma'am made. The structure and function both need correlation. And if you had a polycystic morphology on sonography, it needed a correlation of a biochemical marker like an AMH. Many a times structurally you might have an abnormality, but the function may still be normal. So the androgen part of it, the hormonal part of it, tells us that you could ensure that we need to have some surrogate. This is a serious disease.
Yes.
And what these fallouts show us is that there could be a cancer risk.
Exactly.
Because when insulin works, it has a metabolic effect. It locks, as you said, lock and key, like a key,
Yes.
on the cells to give glucose inside. It also stimulates receptors like IGF-1, which are growth factors.
Right.
And they stimulate too much of growth. And when there is too much of growth, you get cancers like endometrial cancer or breast cancer. Second is, it causes serious diseases of heart and diabetes. So you get diabetes, dyslipidemia, hypertension. But beyond this, because of the cosmetic consequences, medical consequences, fertility-related consequences, cycle-related consequences, and endocrine disruption of androgen excess, we also get mental health issues. And those are very huge issues, including anxiety, depression, and emotional lability. And in a reproductive lifespan of a woman, every cycle, if a cycle is disrupted, her life cycle is disrupted.
That is a fabulous
And I
point he
think
brings out.
this is something which we need to recognize, that the fallouts of this consequence are huge. And it's a serious disease, it's a serious medical condition which needs medical attention.
So
it's not a cosmetic condition.
Is it safe to say that we don't look at it as seriously as
Absolutely,
we should be?
absolutely. It's just not something to go to a cosmetologist to fix it.
Absolutely.
And it needs some attention beyond just fixing the cosmesis.
That's a fabulous point, and I think we should be taking home this message that a PCOS fallouts don't restrict themselves to just the pure, as he said, cosmetics. But there are deep-seated issues which will pop up later. And there again, the girl herself may be going through depression, which is a fabulous point you brought out. Because we tend to ignore this, especially in adolescent phases or just beyond. So I think you have brought out the various parts, and I think this particular slide also sums up more or less. So I won't waste time, except that I know for a fact that this small little pink bubble here, fertility problems, is where I restrict myself to. But a lot of you actually are facing, or a woman faces, a lot of the other things which are important. So as I said, as a fertility expert, I am only interested in looking at the egg she brings out, and that's the bad-looking egg that I've pointed out there. But essentially, we can't forget that we are dealing with something serious. So now coming to the insulin resistance that she was talking of, and for you saying the lock and key, you almost gave us the key. So can you simplify that point about insulin resistance while I throw a few slides? And then she will also help us and understand this deep-seated issue.
So, every cell of our body needs energy. Energy is given by glucose.
Correct.
So the glucose has to be transported inside every cell. And the pathway for every cell to go inside, every cell has a receptor called GLUT. And this GLUT for example, beta cells of the pancreas is GLUT2, on the skeletal muscle is GLUT4. So what happens is, insulin is like a key which gets locked on the receptor. When it gets locked on, the GLUT gets open so that the glucose enters the cell.
Absolutely.
And when the glucose enters the cell is normal. Unfortunately, what happens in insulin resistance is, either the receptor gets locked, so there is like, now it is like monsoons, and our keys get locked. Same thing will happen, and or the GLUT is blocked. So that is insulin resistance. So there is a signaling defect of the insulin, and that is the key. And because of all our lifestyle issues, and we are putting on some fat and lipids, and the lipid biology is affected, we are getting this problem. So insulin resistance is the core, the central core of the entire PCOS conundrum. And all what you see is nothing but different variants of degrees. Some may be mild, some may be moderate, some may be severe, some may be critical. And that impacts hormones, it impacts our skin, it impacts our bodies, milieu. So it's our environment which changes. So I think this is a very simplified.
So is it safe to say that all women with their main doors, I'm meaning it well, would require the keys to be inserted and shimmied a little more, from anywhere between 50 to 80% would require a lot more effort compared to others, and of the same age group. So it is not something that has no basis, which is why I brought this topic on only after we decided that it was serious. And therefore, I think you summed it up beautifully. And therefore, I won't go into the other part, which is more technical. But I want you to, madam, look at this now. And this is interesting because this is an AI-generated picture of Hollywood's diva, Catherine Zeta-Jones. So this is, I don't get sued for putting up a wrong representation of Catherine. But the point is, more or less, this is what is happening. So a visual fix. I want you to now start looking at somebody coming to you with these body issues and how do you cope with them, both as a technically sound person and the psychology part of it, if I may.
Okay, I think a very good question. I would like to start this conversation by going to hyperinsulinemia, because that is one of the reasons which leads to insulin resistance. And if I go backwards, what leads to hyperinsulinemia? It gets connected to the diet which we are consuming. And in diet, specifically carbohydrates, the refined carbohydrates, the simple sugars, excess of it, more frequent intake, larger intakes, the HFSS story, the high fat, salt, sugar story, the ultra processed story, all that comes in. And you can really correlate that picture with the persona of the people coming here, right? So that's one origin. The second is, that is not only leading to hyperinsulinemia, but we also know that hyperinsulinemia leads to adiposity.
Yes.
So it's like, one thing getting linked to the other. And it's so insidious that where it begins, you do not realize. I must share this data. We have screened 1,300 older adolescents and young adults in the city of Mumbai in the age group of 16 to 25 years. You will be shocked to know.
In fact, I had the data on a slide.
That 30% of them were pre-diabetic.
Exactly.
They were hyperinsulinemic. They had high inflammatory markers. And majority of them were normal BMI.
Exactly.
Or slightly low BMI. And when we dealt with those individuals, they had never gone for a blood test. Like they could never even fathom to think that there's something going wrong within my body. Because I'm fine, my weight looks fine, I'm doing all what I need to do. What is wrong with me? But at the subclinical level, they are having low-grade inflammation. They are having hyperinsulinemia, which has not surfaced as overt diabetes. Right? So that's where is the background where it is coming. The insulin resistance story begins there. Yeah.
So the interesting part was we were taught very early on that hyperinsulinemia means you will not gain weight, or for that matter, you'll burn more fat. But it may be a disruption rather than something that looks 1 + 1 = 2. Now, here's this body image thing. Again, a very interesting picture, because most people like to see cat videos, etc., I was told. So you can have these exercise videos or this body image thing. And there's a very simplistic way of solving the problem, which is done by most people. So I'm putting this under the name of lifestyle management. It's nice to have complicated names given to simple problems or simple solutions. So here's something that we take forward. And again, various forms of exercises, apart from the dietetic help that they need, are offered. I don't know how far that would be right or wrong, but having said that, I think just for the public at large to understand, it would be appropriate to say that we would be looking at it more seriously than just a obesity issue. Am I right in saying that?
Absolutely. Absolutely.
So now, Dr. Shashank, the therapy options in PCOS, we've discovered that it's going to be a board of people who are going to come in and help us solve this problem. We do agree that there has to be a slightly different kind of an approach. It can't be like you come in, walk into my chamber, pick up a prescription, take a drug and get better in 5 days' time. I think I would like you to just look at this and maybe comment from the standpoint of what you would agree and disagree with.
No, this is for lay people, this is too complex.
I know.
Okay,
that's exactly why I want you to
But I think, let me tell you that lifestyle is still the key.
Yes.
And counseling is very important, and resurrecting image is important. But somebody who's emotionally distressed and wants a cosmetic solution, has, cystic acne, a lot of hirsutism, that girl is not really going to look at all this.
Exactly.
She wants a cosmetic and a hormonal solution. So A is lifestyle, and then, to treat insulin resistance, we have metformin. Weight loss is crucial. You can give meal replacement, you can give orlistat, you can give GLP-1 receptor agents. And then we have anti-androgens, which means hormone blockers to block the androgen, which is like finasteride or say spironolactone. And then we have estrogens or contraceptive pills, which are often used. And they will just block everything and get you a cosmetic result. And many a times we do dual combinations, like which are, that means you give an estrogen with a male hormone blocker. So fundamentally these have to be done under medical expert supervision of a gynecologist or an endocrinologist or a cosmetologist. And all the three experts sometimes have to work together.
Absolutely.
So they need to cross collaborate, and it also depends on the outcome. If the outcome is cosmetic, you need to do cosmetic surgery or the cosmetic therapies, but with that we may still need to give a metformin weight loss and or a contraceptive pill or an anti-androgen. Same thing is true with madam or you. If you are looking fertility as an option, then the entire approach is different. It could be metformin with a letrozole or a clomiphene citrate. So I think it is an individualized approach.
Yes.
Every woman with PCOS is different. She's unique. You have to say that she comes with a different molecular signature. You need to give a signature treatment for that woman, counseling her, giving her an image booster, reassuring her that we are going to fix not only just the cosmetic problem or the gynecological problem, but also the root cause. And I think in the root cause, lifestyle, weight loss is equally crucial.
That's a brilliant answer to not only how we should approach it, but we should know end goals at that point of time. Madam, I come back to you. You must be seeing a variety of people, and clearly when we put this through her lifetime, a woman at various stages will be visiting a gynecologist with different facets of PCOS, and they need to be addressed. How can you stratify them? We've taken care of the adolescents. And I think what we would say, if she is young and seeking fertility, more or less we have to work, as he said, with that as the end goal. Can you elaborate a little bit from, let us say, childbearing onwards to, let us say, early menopause or premenopause? Can you tell us something more on that?
So as I told you, I see women from different age groups, and I've got groups of women who have been coming to me for the last 30 years, where I have their data showing what's happening to them over the years. Now there are some who come to me who have started treatment and they would continue, and I know what's happening to them. But the ones who have come, got their problems solved at that point in time, I may not have access to what's going on with them. So in short, we need to keep track of these patients, with these women, and alert them at the first, not at the first visit, but as we go along. At least I believe in doing all the investigations to make sure that what is the problem with this young girl. Even if she's come to me for infertility, I may still do all her tests to know where we stand. The reason is because I'll treat her infertility, I'll treat her, she'll have a baby, she'll be happy, she'll go home. But at the same time, she will not know that she has this problem.
Absolutely.
Say her male hormones may be high, her lipids may be high, means her cholesterol, etc. may be high, her insulin may be high, and if we don't correct that problem, then that baby which she'll carry in her womb is subjected for 9 months to those abnormal situations inside the uterus, which then changes or causes problems to her genes, causes mutations or changes in the genes. The DNA will not change,
exactly,
but there will be some mutations.
The phenotype will represent itself
and
differently.
then the children born are the ones who will also develop PCOS.
It's a very fine point you make, because we tend to ignore this point, and also the fact that a postpartum woman taking care of her child still is undergoing tumultuous changes in her metabolism. And I think both of you would agree, the stakeholders here, that lifestyle management happens to be the backbone and contributes significantly. Do you agree? Because Madam made a very valid point. She is going to tell.
In fact,
yes.
I'm going to substantiate further on what she said. See, nutrition during pregnancy is something which is so important, and that needs to be highlighted by every gynecologist. So what she mentioned about correcting what is not okay in the women, that's one aspect. But even if everything is okay, I still feel there has to be a lot of emphasis on quality nutrition going in trimester-wise during pregnancy. Because we know that the seed of what happens to the offspring later in life is laid down in that phase.
No, there's a very nice point Madam made about the career path of a female girl, let's say born to a woman of PCOS. She will have probably a different metabolic pattern through her early part, if not post-adolescent, which is again something which we tend to miss, which we could have corrected probably. And the second point you say is the woman herself. So my point to you, Madam, is that woman who, as you said, came to us for fertility, let's for one moment forget that part. Let's say from her 30s, late 30s to 50s, what are the things you would want our audience to take home as some kind of markers, beacons of light for them?
Yeah. Actually, in those 20 years, I've found most of the women, once they've completed their childbearing, until they reach an age of 50, by the time their children are grown up and taking care of themselves, women tend to ignore themselves. Women tend to completely forget that they need a health checkup at a regular interval. They need the regular health testing to be done to make sure that they are not developing diabetes, to make sure they are not having any early cancer detection, no pap smears are done, nothing is done. 20 years they disappear from the scene, and then you ask them, where were you, why didn't you come for your check? Oh doc, I was very busy with my children's education, now they've gone to university, I'm happy, I've got time, and now I'm going to start my exercises, and now I'm going to eat the right diet. The question is, exercises, yes, they will start. We don't know when they will start. Parties are galore going on because there are no small children at home. So it's a question of how you take that woman, but I'm talking in principle. Even our Indian traditions of post-delivery, giving them lots of ghee to eat,
yes.
I don't know how nutritious that is. I don't believe in it, but I think she'll be the
She's
right
vehemently
person.
shaking her head saying it's not nutritious.
Protein intake and a good diet for the baby to get good quality breast milk, and for her to remain healthy for the next child maybe, or for herself. So in short, we see that between 30 to 50. They may, by the age of 40, they may develop early periods. They may develop delayed periods with heavy bleeding. They may develop anemia because of that heavy bleeding.
Absolutely.
When they feel weak, they may have actually developed diabetes by then because they haven't been monitoring their... Because PCOS is a high risk factor for diabetes, and in our country, which is the second capital of diabetes in the world, now maybe first, we need to make PCOS women aware that every year they need to check their lipids, their sugar, etc.,
Madam,
to make sure they're not developing diabetes.
Exactly. It's a pre-diabetic thing that they should be well aware of.
So when they have diabetes, then they have all these other issues coming up, infections, urinary tract. You said till 50. So till 50, these are the problems we see in these women. Only when they have a problem, they'll come to us.
True.
And say, this is my problem. Then when you do the test, you find all these various issues are there. And by the time they reach, they usually tend to have a little later menopause, little later.
So, madam, can I say that for all the audience here and for the audience that is listening to us, we as doctors tend to be very pessimistic and give what is called as a very guarded message, a very negative message to them. Can I say, with the two professionals here and the dietetics expert adding to this, that there is a very strong positive message coming out of this, saying that if you attend to it on time,
Correct.
you're going to not only turn it around,
Yes.
but at least the intensity of the disease or its complications are going to come down. I want both of you to independently comment on it.
I think 100%, Kaustubh. I think one message I want to tell everybody is PCOS is a 100% reversible condition.
Please wait. I want everybody to clap for that.
It's a reversible condition.
Repeat it. Please
It's
repeat
a reversible condition. We
100% correctable, reversible.
Yeah,
Thank you.
and it can undergo remission. We have published data on that.
Yes.
And it needs supervision. There are a lot of subtypes, and not necessarily you are in the worst subtype.
Exactly.
Okay, so you need medical attention, medical supervision to do that. And I think medically getting it, undertaking a journey of it is crucial and important. Also, I feel after fertility, as madam said, and after adolescence and cosmetic needs are over, the real lurking danger of PCOS comes up. And that is the time the cardiometabolic complications hit us.
Absolutely.
And that really, and cancer comes in. And that's the time we need to nip it in the bud, and that's the time we ignore it. So I think for all the women who are crossed their 35s and 40s, completed their reproductive age, cosmesis is not a challenge, they are heading for a menopause, they need to be more vigilant for their own health, their own image. But I think I love the conundrum you said, that we have to be very positive, we need to be proactive, and this is something very treatable, very, very controllable, and very, very reversible. And remission is something which is possible. If we falter on a point like medical supervision or lifestyle, you might get a recurrence or a relapse. But I think remission is possible, and therefore we should always say that smile and try to get some medical advice and be motivated. I think unfortunately what happens as a group, we go into a negative spiral. The idea of this whole program is not to scare you all.
Absolutely.
It's to educate you all, because if you're educated, then you will seek help. And for every problem, there is a solution. And there is a different expert for that.
So, the beauty of this is like that snake and ladder game we used to play in our childhood. If you come down a snake, you still move 2 houses, you're going to go up a ladder. So
Absolutely.
That's a very good take-home point you make, sir. And I think we should take it home from this discussion. Madam, would you like to add some concluding remarks to what you think the PCOS Society is doing, what needs to be done more, what should involve other people? And I am here wishfully thinking that everybody is on board, thanks to discussions like that. And the Vijayeta program, for example, you're doing a fabulous amount of work by approaching colleges and delivering talks on the topic like this, and they may not be as highbrow as this, and they seem to go well. And then I'll come to the dietitian to specifically help me out.
I think 10 years ago we created the PCOS Society of India. The intention was to create the awareness that yes, you could be having PCOS and there is help available for you, and it's a multidisciplinary approach. So wherefore we created the organization with a multidisciplinary team, including Shashank, Joshi as endocrinologist, Rekha Sheth as dermatologist, nutritionist, and we've had lot of multidisciplinary sessions with multidisciplinary organizations, which include the Cardiology Association, the Psychiatry Association, different associations and international associations. We have also supported the guidelines which have been made in 2018 and 2023, so that everybody knows how to diagnose. There are algorithms in place. There is an app which is in place. There's a lot of stuff available for people.
Can I actually go around to congratulating you for doing all that? Please put your hands together for all that has happened. It is actually a group of people, and all of you should take a bow for the effort that you have put in collectively with the leadership of Dr. Duru Shah and her, multifaceted, multidisciplinary approach, which really needs to be carried on 10 times more, madam, maybe 100 times
so
more.
actually we did the Vijayeta program, which is outreach program to women and girls, etc., 2 years ago through a CSR fund from Philips. And of course, we continue with the project now. The idea was to see how much these kind of sessions are helping women. We looked at the knowledge of the people who were attending before the program and checked the same questions after the program. And we found that there was a 30% increase in their awareness and knowledge on the subject, because knowledge is wealth. I think the more knowledge you have on your problem, you can always overcome it. And that's why I believe counseling is a very, very important aspect of PCOS. Though some people may say, doctor, I've come to you for infertility. Why are you doing all these tests? Then I have to sit and explain why I'm doing everything, and that helps a lot. Now coming to what exactly we do, we create awareness. And I think we did a tremendous job as a group of doctors. I think almost 75 to 100 doctors joined us nationally. We did programs in corporates, in universities, etc., a lot of places. And we are happy to announce actually that last week we got an award for one of the best organizations in the country who's doing a lot of good work on PCOS. So very happy to say that, and feel happy that, you know, whatever we have done is going in the right direction. And we are also looking at how we can make it simpler for women to get themselves diagnosed for PCOS. So in short, simple questionnaires. We did an assessment of the more than 20,000 people we did physically, and we touched 3 million lives virtually. But the thing is that we assessed that almost 1 out of 5 women are suspected of having PCOS based on the questionnaire we gave them. And that alerts them that, yes, maybe I have PCOS, I need to see the doctor. This is what we told them: we suspect you have PCOS, we suspect. Please see your doctor.
As a member who was participating in the Vijayeta program, Madam,
he was one of our PCOS champions.
Thank you so much for allowing us to, you know, be of help to society, if at all. And I must thank you for that initiative. And I think it's going to get further multiplied. And it is something like a small step in the right direction. And I'm sure there's more happening. I would like to go to more mundane issues, because our dietetics expert should comment on this, because this is an issue which I think is a simple solution to a more complicated problem. Have you noticed during the entire discussion, Dr. Shashank barely got to talk about medicines at all. And all he did was to say that he would hand the baton back to the lifestyle modifications. So here's something that, we tell a lot of our girls who come in for fertility treatment, that just a 5 to 10% reduction in body weight can turn the whole needle back into a less dangerous area. Do you agree with that?
Yeah. Okay, so I think I'll take your first question
yes, of course.
And then come to this. So if you ask me as a nutritionist, I vouch for the statement that preventive nutrition is far more stronger than curative nutrition. Mm-hmm. So we don't have to wait for the problem to occur. We have to work towards it much earlier. And why I say this with so much of conviction, that today the science, the robust science of nutrition which is available, and I think all my fraternity who's sitting over here, they are aware that today's nutritionist is no longer talking generic language. Today's nutritionist is talking specific language, wherein she's quantifying the specific components in the diet. She is making a checklist of the food in defined portions, in defined frequency, and it's actually a food-based prescription, which is backed by robust science, and the backdrop is that all those components which work towards insulin sensitization, which work towards lowering inflammation, which work towards lowering visceral adiposity, are embedded in that prescription. And that prescription is a prescription of everyday food. So you tell me, you as a doctor, when you write a prescription is a specific compound which you quantify, you give the frequency, and you tell the patient, please have it. If you will not have it in the quantity, in the frequency, it will not work as a medicine. The same logic you apply to food. Today, if I'm saying that, we can be that specific to quantify and state the frequency of everyday food, and if we follow it to the T, even if not 100%, 80%, believe me, it works like a medicine.
The most brilliant part of this discussion is the fact that with two experts who love to put their prescription pads to good use, you have acceded ground, not only logically to a person who's saying there's prevention, there's ways to get. I think this is the best you could get out of medicine, where we come in as last resort. We are the ones who are holding the fire hoses to douse a big fire, when she's talking of putting down the small fires, which is extremely good. And I not only endorse this, but I think she made the very valid point that medicines themselves will work better, if not be required altogether, if we follow these simple diktats which are there. I know there's a lot of discussion and time that can be available to us, but I was told that like these three talking heads, I'm sorry, no comparison with the three figures who are sitting here, and please don't pick sides for this. It is incidental that I have three penguins here who incidentally are suggesting a very good alternative. Ladies and gentlemen, believe you me when I say that I have had a very interesting latter part of Sunday evening, discussions which led up to something which brought a smile to my face. I hope it does to all of you. Ladies and gentlemen, I thank you for your time, and to my three panelists for a brilliant exposition on simple ways of making a complicated problem go away. Thank you.
I think we must give a big hand to him for an excellent moderation.
Kaustubh, you are simply superb.
Ladies and gentlemen, I'm sure you have enjoyed this panel discussion and have a lot of take-home message. And now we are going to learn about PCOS in a fun way. We are going to have, all the noise was on this side of the stage. Now I want the noise on this side. So we are going to learn everything that is there as a take-home message through a Tambola. Sham and Riddhi are going to distribute tickets, the Tambola tickets, housey tickets to each one of you. Please take one ticket. ये कहाँ लगाना है? लगा दो. पॉकेट नहीं है. ये पॉकेट नहीं है. पॉकेट नहीं है. पीछे लगा दो. इधर रख दो. चल रहा है क्या? Can you hear me? Can I request everybody who's sitting in the back, please come here. There is a lot of place and there are lots of prizes to win. So you don't want to do all the exercise today, running in the front to collect your exercise gifts. Mera prizes, Sham. Smart girls, please come in front. Please take a ticket. On the top right hand corner, please write your name. Then एक टिकट मुझे भी दो. So, how many of you know how to play housey? सबको आता है? Okay, this is going to be slightly different. What we are going to do is, see, you are going to make your own ticket. So, in the first grid, I have written write numbers of your choice from 1 to 15. Sham, can I have one ticket, please? There are words written over there: acne, hirsutism, etc. Got it? Acne, hair growth, obesity, delayed cycle, infertility. In those 5 boxes, you write any number between 1 to 15 of your choice. Okay? Got it? No, every box you write one number, any one number. So, acne mein you can write anything from 1 to 15. Then obviously in hair growth you will not write the same number. Okay? So, you will have any 5 numbers out of 1 to 15. Then in grid 2, you will write numbers of your choice from 16 to 30. सबको समझ में आया क्या करना है? In grid 3, you will write from 31 to 45. In grid 4, you will write from 46 to 60. And in grid 5, you will write from 61 to 75. So you have only 10 seconds from now to prepare your ticket. Please don't cancel. Please don't make scratches, change the number, etc. Just write once, okay? This is a fun exercise, so no cheating. And we have so many gifts that I'm sure everybody will get. If you're playing, you will get. So now I will tell you, grid 1 is all the so-called symptoms that you have in PCOS. Grid 2 is the long-term problems. Grid 3 is all the kind of testing that you can do for which help you in diagnosis. Grid 4 is all the lifestyle suggestions that we have got. And grid 5 is all the medicines. Okay? Now, I will try, for each point, okay, we are going to try and address, see what is your concern. Kya chahiye? Okay, 1 minute. Sham, where are you? Riddhi, do you have an extra pen? We'll give you. वो pen दो ना उधर. Is the pen working for everybody? Is the ticket ready? Everybody? See, even if, don't cheat, that's all. Okay? Now, before I even start the game, I'm the quiz master. Okay? If 2 people answer the question or 2 people get the same number, are winning, जिधर मैंने देखा वो फाइनल है, ठीक है? नो आर्ग्यूइंग, ओके? फॉर एवरीथिंग देयर इज ओनली वन गोल्डन रूल, आई एम राइट even if I am wrong, okay? That's it. So we start from here. I'll explain what we will do. I will call out the number. If you have that number in any of your boxes, you will tick it. So as soon as you have acne, somebody will say, hey, I got acne, okay? And we go on further. Then there will be a prize for the full grade, first grade, second grade, third grade, and there will be prizes for the full house. Are you ready? Yes. All game? Good. So, shall I call out the first number? Yes. And whoever has acne is going to, okay, whatever it is. If you have acne, you have hair growth, obesity, whatever. You have to be fearless, shameless, and say, I got it. Okay, because you got your number, you got your prize. Okay, for prizes, we have these wonderful protein bars. Okay, and that protein is laced with some chocolate, keeping in mind that we have to have the soul happy as well. So here comes your first number, number 11. Come, what's your name? Trusha. Okay, what's your biggest concern when it comes to your cycles?
My biggest concern, my cycles, lifestyle.
Lifestyle?
Yes, sir. My biggest concern.
Yes.
Yeah.
What bothers you?
Yeah, my biggest concern when my cycle is delayed is PCOS maybe.
Okay. I thought सबसे बड़ा कंसर्न ये होता है कल गणपति आने वाला है, आज ये पूजा है.
Yes.
मेरा साइकिल कब आएगा? गणपति पहले आएगा कि साइकिल पहले आएगा? Correct?
But I had crossed this, so I forgot it.
Okay, please take a seat. So there is one take home message. साइकिल आएगा, किधर जाएगा? Okay, it has to come. Menopause अलग है, PCOS में your cycles are delayed and there is a lot help available to put it back into place. Okay, तुम्हारा husband टाइम पे आए या नहीं आए, मेहनत करने के बाद साइकिल टाइम पे आ सकता है. This is your take home message in PCOS, and how to bring it on time, that we will learn soon. Okay, so this is one protein bar for you.
Thank you so much.
Next number 19. 1 and 9. ए, मुझे दिखता है. Come, sweetie. See, you have to run and come. What did you get? Yes. So what is number? What box? No. You are disqualified. You got blood pressure on 19. Okay. What's your concern?
None, actually. I'm a nutritionist. I help people.
No. So, okay. Blood pressure, your take-home message is that just the way your hormones fluctuate, your pressure can fluctuate. Okay? But when it goes high, it's not good. It is one of the outcomes. Again, lifestyle is one of the best ways to bring it back to a stable level. Thank you. Here's your chocolate.
Thank you.
Okay, let's go with the next number. Number 6. No, you got it. Hair growth. So hair growth, see, once you got one chocolate, leave some for others. Okay? I have more chocolates than the audience. So afterwards, somebody will take more chocolates than the others. So, वो क्या था आपका? Yes, in PCOS, girls will tell you, my hair grows faster and longer than the list of my boyfriends. Yes, it is possible. but you can look after this long growing hair cosmetically by any means that you like. The take-home message is waxing, bleaching, everything is... Can I have water, please? Everything is acceptable, but it is important to know that hair is not just skin deep. The problem lies as deep as your hormones, but ऊपर से सब ठीक करने के लिए you can use all these methods. Okay? So, come. Next, number 17. Wait, I'll call you. That girl with the hair tied like this. Come, pinky. मुझे एक पेन दो ना. और बेटा ऐसा करो, तुम थोड़ा काम कर लो, ये कुर्सी लेके यहाँ बैठ जाओ मेरे. ओके, डायबिटीज. ओके, so what do you know about diabetes? Do you know anybody who suffers from diabetes?
Yeah, actually India is the diabetes capital of the world now, and a lot of people could even be in the pre-diabetic stage and are not aware of that, and if they take precautions at that stage, they can be prevented from getting into a full-blown diabetes.
Yes, good. So, take-home message is that diabetes can be a long-term outcome of PCOS. It is all related to insulin resistance, and you can deal with it. There is a lot of help available in diagnosis and in management. So, seek help to manage it. Good girl. You just choose whichever you want. जो भी box हो जाएगा ना वो tick कर दो. Now the next number is. Huh? She also got, no? One person at a time. Uncle, I'll call you. Don't worry. Number 1. Come. No, hair growth is done. Your sleep. No. Now hair growth is done. Okay, we will go to the next. Come. क्या मिला? Acne. So acne के बारे में, do you all know who is a social influencer? आजकल there are lots of social media influencers, right? उनके बारे में क्या सच है? They start very small, then they grow very fast, then one day they erupt, and then they vanish. Correct? Acne का story same है. Okay? So rest assured, let acne not affect your body image. It will come, it will grow, it will pop, and it will vanish. Okay? Acne is not skin deep. It is also as deep as your ovaries. But this is a fact. It is like the social media influencers. ये टिक किया. Okay. Next number 9.
Yes.
Wait. I will call you uncle. So many women. And we are talking about PCOS. There is no PCTS. If there was a PCTS, I would have called you first. Delayed cycle. થઈ ગયું. So correct. कौन सा नंबर मैंने बोला? 9. So that was come. Infertility. Your concern? You have a concern?
No.
Okay. So infertility is one of the possibilities. It's PCOS. Many women have this problem because of not being able to make eggs. Okay? But take-home message is, again, there is a lot of help available. We can do a lot to help your ovaries make some eggs, right from just ovulation induction drugs to test tube babies to surrogacy and everything. So, in today's day and age, it is probably okay to say that no woman will remain childless. Okay? Not all, 100%, but to a great extent that problem can be dealt with. Again, you just need to reach the right doctors and seek treatment and help. Okay, so next number 7. So we will finish some squares first before we go ahead. Number 14. Number 14. Obesity. Come. We did, no? Obesity nahi hua? Did you come get first before anything? No. Come. So what is your concerns on obesity?
Try to maintain a good healthy diet and a good lifestyle so that you can prevent it.
Okay. So with obesity, it is always like that I don't know who is cheating me more, my weighing scale or my husband. Correct? Every time they both are cheating. So obesity, it is related to weight, and most important is what you're eating and how much you're eating. So we'll come to that, but it is to deal with obesity, you need victory, mind over platter. Okay, we know mind over matter, but your victory lies in mind over platter. Yes. Number 24. वो हो गया. Number 16. 1 and 6, 16. Body image. One take-home message on body image.
Hello. Don't feel shy. Just walk confidently and you are the princess.
Absolutely fabulous. You deserve 2 chocolates. Both. So, for body image, you know, आजकल ये selfie का ज़माना है. Okay? जो भी किया selfie लिया and posted. But you must remember, between the snap and selfie, there is you. And that is the beautiful you. So whether, you know, there is a lot of discussion, क्या पहनना चाहिए, क्या नहीं पहनना चाहिए, लेकिन अपना confidence सबसे पहले पहनना चाहिए. Okay? Irrespective of your acne and hair growth. So, because there is only one in the world like you, and you are beautiful. Okay? So, let's go forward. Number 18. What is that? What box? You got what? No, you're taking too long to get diabetes. Come. Next try karna. What did you get?
18, heart disease and stroke.
Okay. Heart disease and stroke. Take your chocolate. So again, these are problems related to insulin resistance, PCOS, obesity, okay, and timely intervention, first and foremost lifestyle can help deal with it. So these things can happen, but there are a lot of factors. There are social factors, environmental factors, hereditary factors, okay, lifestyle factors. All these influence your risk of heart disease. एक बात याद रखो, दिल है तो धड़केगा, दिल है तो दुखेगा. ओके लेकिन उसे संभाल सकते हैं और दिल धड़कने दो. Who said that? Fabulous. You are a winner, right? So, wow, no wonder. So, in the end, you will get extra ones if I have some. Okay, let's move on. Number 13. Number 20. Diabetes is, see now what is done, okay? So, number 15. Number 3. Okay, listen. Hello. Wait. Who has finished grid 1? Full grid 1? Only you? Come. So, देखो बच्चों, grid 1 is done. Okay, full grid 1 is done. Now we are playing for grid 2, grid 3, grid 4 and grid 5. Okay? So, number 22. You sit now, quietly. Cancer, Aja. So, Manisha, your concerns on cancer?
I would like to advise all females that after everybody should get screening to prevent cancer. Prevention is better than the cure. This is my message.
No? You know, I always explain cancer as love. Okay? That love happens, you don't know how it happened, and suddenly it grows, suddenly it consumes you, and then you think you're finished. सही है? हाँ, कैंसर भी कुछ ऐसा ही है. बट लेकिन आजकल के ज़माने में we cannot let love and cancer consume us. Okay? We are the powerful women. We will control love and we will control cancer. And to control both, you have to start in the beginning. हाथ से निकलने ही नहीं देना चाहिए. So start with prevention, early detection. Okay? So as soon as you start falling in love, you should know हाँ ये प्यार है. Okay? जो infatuation है, जो you have to learn to differentiate. Then once you know the right one, you have to catch it. Correct? And then manage and control. So in the same manner, for cancer, first prevention. So where you can take vaccines, you do vaccines. Where you can do pap smears, you do pap smears. Where sonography can be done, you should do sonography. Then when it comes to early treatment and effective treatment, you can win over cancer. Correct? So let's move on. Chocolate. Number 10. What? No. See, now no calling out for grid 1. Who has finished grid 2? Grid 2 finish हो गया? Come. उसको 2 दे दो. Take 2 chocolates. But you never managed to claim, but you got the full grid. Okay, good girl. Okay, now we are playing for the remaining grids. All right? Number 42. जल्दी जल्दी क्या आया 42 पे? हाँ, BMI. You know, हम लोग जब वेट देखते हैं, so आप ले लो. You think weighing scale में ज़्यादा है, कम है, but you have to realize one thing. बैठिए. BMI is better my image. That is the take home message. That you have to improve your own image और ये आपको खुद को ही करना है. So BMI is a measure of the body mass index, which is a better way of saying, जैसे वो डॉक्टर मदन कह रही थी ना, कि it is body composition. Just because you are thin and fit and fine does not mean that you are fit. It is the composition which makes a difference, and therefore it is your BMI, which is weight in kilos divided by height in meters square, and that gives you your correct image. Okay? Now, number 26. Number 47.
Yes.
No. Yes means क्या? किसको आया portion control? Come. How does one control?
Caloric deficit diet. One can control eating protein intake. They can if we increase our protein intake, then that satiety will full. And
Yes.
before eating your meal, you have the one should sip 1 glass of water. So the bowel movement or
Feeling
food,
satiety. So good, she's given a very good point that if you increase your protein intake, then it gives you longer satiety. So the low glycemic foods, etc. Okay, but if you have to go for a party and things like that. You know, you're going out, you know that tonight I may eat high calorie foods. One thing that you can do is eat some protein item at home, like these protein bars. And then when you go out, you're not going to be as hungry. In most parties, we realize that we are eating more in the starters. Chota samosa, chota paneer tikka, chota mushroom khaya, and you fill up your stomach, and then you have the main course and the desserts. So portion control, most important that you reduce all that you take in, to reduce in quantity wise, okay? I always tell myself कि if I have a cake in front of me and समय तुम नहीं खा सकते, then the desire keeps building. But if you have one small piece that is gives you the satisfaction, it's not necessary to eat the whole piece. Okay? So good. Take your seat. Take your gift. So number 28. Next number 28. 31. 38. Come, quick. What did you get?
31 for sonography.
Sonography. Any concerns?
I just know that it is one of the criteria to diagnose the PCOS clinically.
Okay. So she stands to be corrected. Sit. Sonography. सब लोग sonography report में देखते हैं I got PCOS because वहाँ पे डॉक्टर ने लिख के दिया है कि ओवरी के सराउंडिंग में बहुत सारे cyst है. It looks like the necklace, pearl necklace. तो इतना याद रखो, गले में pearl necklace नहीं पहना, ovaries में पहन लिया. But ये pearl necklace 18 के पहले normal है. So if you are below 18 and you have this sonography picture of polycystic ovaries, it is normal. It is nothing to be concerned about. Okay? It is only afterwards, after 18, that if you have this picture plus a few other factors like acne, hair growth, delayed cycles, infertility, then it makes sense, and then that you confirm the diagnosis of PCOS. Okay? So let's move on. Number 29. Yes. Number 27. Come. Yellow dress. Come. Number 27. Number 43. Waist hip ratio. You haven't got anything as yet? Come. So, what is your concern? Waist hip ratio. कैसे कम करें, कैसे बढ़ाएं? कौन सा बढ़ाना है? So, waist hip ratio is one of the best ways to judge your whole body profile. Okay? It is the best, more important than weight, and it is even better marker than the BMI. How do you take waist at the narrowest part of your waist, hip at the broadest part of your hips, and then you divide. If your figure is more than 0.8, it is a concern. So you want it less. Okay, वो पहले यहाँ 36, 24, 36. Okay, so waist should always be smaller, and this ratio should be less than 0.8. Okay, let's move on. Now I'm going to change the game. Okay. So, कौन सा हो गया? 4 and 6, 46. 3 and 6, 36. हाँ. You didn't come no till now? Come. What happened? What did you get? Intermittent fasting. So intermittent fasting का ये है. How many of you know what is intermittent fasting? Everybody knows. How many tried it? How many think it is successful for you? Nobody. I'll tell you why. You know, हमको बहुत, please take whatever you want. When somebody tells you that this is a formula to lose weight, we all want to try anything and everything. तो जब ये इंटरमिटेंट फास्टिंग में 16 घंटे फास्टिंग करती हूँ, फिर मैं खाती हूँ, it all sounds very spiritual. Then what happens? comes along the samosa, spirituality khatam. Okay? So, fasting or whatever form of diet you want to practice, yes, it works. Intermittent fasting also can work. What you need is commitment to it, and it has to be done in a proper disciplined manner. But always remember, one size does not fit all. Just because it worked for you, it will work for me, aisa nahi hai. Something works for her, something else may work for me. Okay? So try it. If you feel that it will work for you, you can do it. If you can't do it, no problem. If it fails, no problem. It is not the end of the road. It is just a bend in the road. Okay? Thank you. Number 5050. You just came, no? Come. Running. Now if you chota bacha don't come running, it's very difficult. Till then, number 44. क्या मिला? तो पोर्शन कंट्रोल तो हो गया बेटा. यू आर स्लीपिंग? नो. पोर्शन कंट्रोल कब का हो गया? नाउ ट्राई फॉर समथिंग एल्स. ब्रिंग योर टिकट एंड सिट हियर. यस. You got no lots. 3 and 9, 39. BMI हो गया. 4 and 9, 49. Exercise come. So exercise के बारे में there is one take home message. Do you know what is a habit? Yes. Right? How do you spell habit? H-A-B-I-T. Okay. So habit के बारे में just remember one thing. If you take away the H, a bit will remain. If you take away the A, bit will remain. If you take away the B, it will still remain. Great? Yes. So exercise is like a nasha. First 6 months, you have to force yourself, get up, go to the gym or go to the swim. And after 6-8 months, if you have done this much regularly, believe me, I'm willing to write a check as a guarantee, okay, that if you do it for 6-8 months consistently, it will become a habit. और फिर there will be time when you say दुनिया इधर की उधर हो जाए, पर मुझे मेरा walk करना है, मुझे मेरा swim करना है या मुझे मेरा gym जाना है, okay? But first 6-8 months is difficult. So make exercise a habit. That is your take home message. I love it. Number 3 and 5, 35. 4 and 8, 48. See, portion control ho chuka. What about blood test? क्या आया 35 पे? Come. हाँ, sonography is done. She's got sleep. Come. Who's got blood test? Come. Come. She's not coming. What did you get, my dear? Sleep. Any concerns?
Yes, because right now, because of our lifestyle, our cardiac, our lifestyle has been so much challenged due to screen timing, due to stress, yes. Due to various dietary changes. So our cortisol also have increased day by day. So sleep lifestyle, which we should have 7 to 8 hours sleeps, it has always been deprived. So from my side, which I will suggest, to improve your circadian cycle, you need to be more focused, you need to do a lot of good exercises, good diet, and try to avoid screen timing.
Yes. So it's very important that you need to switch off your gadgets. I think the biggest problem all of us face is that before we go to bed, we have to see WhatsApp. हमारा social media, कितना likes आया, क्या हुआ, and then you will switch off. But if you switch this off, listen to some nice, pleasant music, eat light dinner, and after dinner do some walk or go for a stroll, and then you will be able to sleep much better. Okay? What is important is not only quantity but quality of sleep. Okay? Yoga, meditation, all these things go a long way to help in sleep patterns, improving your sleep. Blood tests. So lots of blood tests are required. Everybody feels कि डॉक्टर ने इतना लंबा लिस्ट लिख दिया, बट वेरी सैड टू से कि आप लोगों को समझाने के लिए कि वेट कम करो, डाइट कंट्रोल करो, वो सब लंबा टेस्ट ज़रूरी होता है फॉर रूलिंग आउट वेरियस अदर प्रॉब्लम्स. सो ब्लड टेस्ट आर इम्पॉर्टेंट. हे, डिड आई गिव यू द चॉकलेट्स? ओ, आई एम सो सॉरी. बेटा तू दे ना, तेरे को तो मिलने ही नहीं वाला है बाद में. प्लीज. Okay, so number 30, 3 and 0, 30. Number 3 and 4, 34. So we finish these two grids, which is वो सब हो गया है. अभी हार्ट अटैक हो गया, स्ट्रोक हो गया, अभी इलाज का टाइम आ गया है. 4 and 5, 45. Who has got diagnostic criteria? You have? Come. So as I said, for PCOS, take home message is that there are certain criteria. You should have proof of acne, increased androgens. You should have a proof of not making regular eggs, and or you should have sonography picture. Any two are enough for a diagnosis. Please take. So that is a diagnostic criteria. What about number 4 and 1, 41? Now, 5 and 8, 58. 6 and 6, 66. 1 minute. What did you say? Obesity drugs. Come. Now this is the most fashionable thing today. How many of you have heard of, tell me the names of the obesity drugs.
Ozempic, Mounjaro, there are plenty, and there are certain fat burners people resort to lose weight. That's not right. That should really be the last resort. Ozempic has its benefits, but it has a certain criteria. Only those people can take it. It has to be a titrated dose. It has to be monitored by a doctor. There are a lot of things to it. And still there is no guarantee that's going to work for you. Also, the weight might just come back. Again, coming back to lifestyle changes, that is the most important and the most effective way to manage your weight, PCOS, and any other health disorder. So just eat right.
So, you know, all these drugs, according to me, are like your dates. Aya or Gaya. What will stay with you is your lifestyle. Okay, stable relationship with your diet and exercise. Have a stable relationship, because all these Mounjaro, Ozempic, you know, they are like your dates. कुछ अच्छा है, कुछ बुरा है. Then you have to sit and decide क्या मंजूर है, क्या मंजूर नहीं है. सब बात की एक बात है, nothing like good lifestyle. So let's move on. Number 54. So now 6 and 4, 64. Metformin. Very popular drug for diabetes. Okay. Many a times when the doctor tells you that you have to take this diabetes medicine, you have a lot of concerns. But believe me, it has been time tested. It has been in the market for more than 50 years. And it has definite benefits in the subject in managing PCOS. So don't hesitate to take metformin if your doctor prescribes it for you. Okay. 6 and 3, 63. 5 and 5, 55. Inositols. Come. कोई रह गया है जिसको अभी तक चांस नहीं मिला? Okay. Inositols, please help yourself, whichever you want. Again, they are like they are sort of medicines. They have some benefits in managing PCOS, and they don't have as many side effects because they are not totally pharmaceutical in a way. So they are very safe to take, and again, if your doctor prescribes them to you, please try them, please take them, don't hesitate. Well, in a way, yes, because they are not like really medicinal products, but they are very useful, and they have to be taken the way the doctor prescribes. Yes, myoinositol and dichloroinositol. 6 and 2, 62. 7 and 1, 71. So now, on this number, I want somebody who gets diet. 5 and 1, 51. No, those who has, I will give only diet just now on the numbers that I call out. 5 and 7, 57. I want diet, 5 and 2, 52. Who's that? Come. So you had diet before. What did you get now? Okay, great. Come. Wait a minute. We have finished grade 2 and grade 3 earlier. Grade 3 किया ना हमने? किया कि नहीं? So come, grade 3 come. And you take for grade 4. Come. Okay, now 7 and 5, 75. Bariatric surgery, come. So, how many of you know about bariatric surgery? Everybody knows? Anybody has done bariatric surgery? So, come. No, you take. I have lots.
Thank you.
So, what is your experience about bariatric surgery?
It is good and it lasts, but you need to have the portion control still. What happens is, as the years goes by, the elasticity, as you know, stomach has elasticity, then it grows, okay? And then the person can consume more than required. So what happens over a period of time, they again start gaining weight within next 10 years or so.
So there is just one take-home message about bariatric surgery, that it definitely has a place, okay? In the whole armamentarium, there is a place for bariatric surgery. लेकिन bariatric surgery में वो आपका पेट स्लीव की तरह काटेंगे, साथ साथ आपका जेब भी कटेगा, ठीक है? तो उससे सस्ता ये है कि हम प्लेट को काटें, ओके? और वो काट के सिलाई करने के बजाय थोड़ा सा सिलाई यहाँ पे हो जाए, ओके? So that is your take home message. Grade 5 complete? Come. No? तो उसने अनाउंस नहीं किया होगा. Come. 7 and 3, 73. We just did. ठीक है, ले लो. So now all the grades are complete, but now we are going to play for full house, which means I had PCOS, I diagnosed it, and I managed it, and I conquered PCOS. Okay? So till we have chocolates left. All right? Okay. So let's be quick. 3 and 3, 33. 6 and 7, 67. No. What? Yes. Now we are playing full house. Okay? So, abhi you don't have to say hormones hai, diet hai, portion control. What you have to say? I conquered. No full house. I conquered PCOS. What will you say?
I conquered PCOS.
Okay.
Madam, can you please declare all the numbers till date which are...
No. If you missed, you missed. 5 and 3, 53. 2 and 5, 25. 2 and 3, 23. 2 and 1, 21. 3 and 2, 32. 7 and 0, 70. You are disqualified. I just said what you have to say. 5 and 6, 56. 7 and 2, 72. 6 and 1, 61. All the numbers in all your grids should be struck off. उसको full house बोलते हैं, ठीक है? और अगर आपके सब नंबर कट गए तो आपको बोलना है I conquered PCOS. Okay? 7 and 4, 74. 6 and 5, 65. 6 and 8, 68. 6 and 0, 60. 5 and 9, 59. 3 and 7, 37. Single number 5. Single number 8. 1 and 2, number 12. Single number 2. Come. Excellent. So do you have a take-home message from today's session?
Definitely, most definitely. There's a lot to learn from today and really grateful to be here because there is so much that we can do about PCOS, and the biggest thing is that it is reversible. So
Great.
I think that's the biggest thing.
Please come and inko de do. Take 4 of, for all the full house you get 4, okay? So till we have more chocolates, okay? Now it is number 6 and 9, 69. Come. Sit. You are disqualified. No, what? Conquered what? Boyfriend? Say, repeat.
I conquered PCOS.
Come. Single number 4. Single number 40. Great, come. You got? So, I have called out all the numbers. How come all of you have not struck all the numbers? 7 हो गया कब का? 40 पे किसका हुआ? हाँ, उसको 2 दे दो. But you are announcing very late. 7 got done long time. No. Everything is done. Okay. No. So, friends, we are done because we finished with the game. Okay. I hope you enjoyed. And I hope you will take home all the correct messages. So, thank you very much. I would like to thank the PCOS Society and the entire team for giving me an opportunity. And I thank you for joining in so enthusiastically. Thank you. Thank you. Sorry? So I am... Hello. I am Dr. Sangeeta Agrawal. Sorry, I forgot to introduce myself. I am Dr. Sangeeta Agrawal. I am a founder member of the PCOS Society. I am also a gynecologist and I am practicing in Prabhadevi. Thank you. everyone. अब प्लीज ये लाइट्स बंद कर दो, मैं सांस ले सकूं. No, it's